Recovery from heart surgery requires close monitoring and support. Now, through the Heart and Lung Institute, teams across community health system are coming together to safely get patients moving soon after surgery, helping decrease recovery time and improve overall health. When a patient comes out of heart surgery, cardiovascular nurses like Zua Mua work alongside other team members to prepare the patient for recovery.
Once they're out of surgery, making sure they're awake, making sure their lungs are awake enough to have their breathing tube taken out. So we work really closely with respiratory therapists.
Mua says one of the first goals in recovery is to safely get the patients up and moving as soon as possible.
Once the breathing tube's out, then we make sure the patient's stable, their blood pressure stable, their heart rate stable, and we set them up at the side of the bed. Then we stand them up, and then we sit in the chair. And sometimes this happens, oftentimes this happens at the same day of surgery.
The idea of getting patients moving early is not a new practice.
No, this is not new. As all medical practices have advanced with technologies and trying to minimize recovery and bad outcomes or complications, we've realized the sooner we can get a patient up and moving, the less complications they're going to have.
Adam Shepard is manager of rehabilitation services at Clovis Community and Fresno Heart, and says cardiac patients throughout community medical centers are benefiting from the close collaboration with rehab services. Physical therapist Kyla Jacobo is one team member who works closely with patients recovering from heart surgery.
We'll go in there and do an assessment. If it's deemed safe to mobilize them, then we'll get them up and moving. This is going to help to prevent muscle atrophy from prolonged bed rest.
Jacobo says getting up and walking after heart surgery can also help the lungs.
It's going to help to promote lung function. We have small sacs in our lungs called alveoli, and after surgery and anesthesia, those sacs can collapse, and it prevents proper oxygenation of our body. So being in an upright position is going to help to drop the diaphragm, open up, expand the lungs, and it'll ultimately help them to wean off the oxygen more quickly.
Patients come out of surgery with chest tubes, which Jacobo says can cause quite a bit of discomfort.
I like to tell them the more we're up and moving, the faster those will drain and the sooner those will come out, which is usually a big relief when they pull those out.
Mua says the team at the Heart and Lung Institute is there for every patient every step of the way during their heart care journey.
I wish people could really see what comes in and out of our doors, because the surgeons are amazing. They're so dedicated, and they're so skilled, and our staff is amazing as well. And everyone's so committed to helping people in the valley. These are our neighbors, our friends, our families that we're helping.